When I decided I was going to become a doctor, I did not think as far as specializing. But what I found, when I look back, I think part of it is there must be something in me that responds to the need for advocacy, because what attracted me to, psychiatry was just the idea of you being okay today and seeing things as the average person is seeing things, and then suddenly the world is completely different to you. That interested me because I was very interested in knowing what changes to put you in that state. It did force me to look back at the reasons why I came into medicine. And then having COVID thrown upon us again reinforced the idea that you came in here to do more than just the average, if you can. I think that's when I was able to look beyond just the clinical services, just the academic, and to look at what are we doing for the community around us. And I must say that was, I suppose the appropriate time to ask that, because just sitting and trying to work out how we could help, I was able to come up with an idea that instead of waiting and saying, okay, come to us when you have a problem, it would be a good idea to actually go out there and provide the support so that people can feel that they are supported. The first time that we really, as a team, went out and did something which made a difference in the community was when we received the call, initially while I was in Mthatha, about a major traumatic incident that had the effect of mass trauma on a team that was working all the way in All Saints Hospital. And then when COVID happened, we were again confronted with the same thing. You got people exposed to mass trauma, and our healthcare workers, as much as they're taking care of people who are, suffering because of COVID, but nobody was really taking care of them. So similarly, we then had a multidisciplinary professional team of doctors, social workers, nurses, counselors, going out there and offering it to healthcare workers who were interested. The highlight, I must be honest, came with the COVID, and it wasn't once. It happened the first time, and it was repeated again and again and again. Remember when I came up with this idea that said, let's go out there and do this, it was more like, I have to do something. Everybody else is doing something, so let me do something in mental health. But the highlight was when each and every person who walked out of there said, thank you. This made a difference.